Thank you very much. We're really honored to be here and to be on this stage with and in this audience with so many other people. I just have a few really brief remarks, three statistics and then 3 comments that I think relate to what's happening here. One is a statistic that really animated Jeff Brenner's work in the Camden Coalition is that 1% of consumers consume 30% of the resources in our healthcare system. And why is that? It's actually because 10%, so there's another important study out there that's actually been validated now a couple of times around what really drives our health outcomes. So 10% of our health outcomes actually come from traditional medical care. Do you know what drives 40% of our health outcomes? It's individual behavior. But the thing that drives the next amount of health outcomes, 2 and 3, are environmental factors and genetics. I may be getting the orders of that slightly wrong. But those 3 factors really continue to animate the work that we do in contributing to a culture of health. And coming out of that, 3 sort of really important points emerge. One is that to build a culture of health, we actually have to change the way we allocate public resources. So we are overspending on the things that contribute the least amount of health to our population, that being traditional medical care. We need to stop medicalizing social problems. We need to stop criminalizing mental health issues and behavioral challenges. Those are things that we have to do along the way. Also, we're in the land of no easy answers now in trying to build a culture of health. There's no pill, there's no procedure, there's no diagnostic that's actually going to allow us to build a culture of health. We need to spend time doing innovation on the delivery side. And there are going to be a lot of failures along the way. So what I would say is, in building a culture of health, I'd also encourage a complementary culture of failure. So in addition to being acting CEO, I've also been COO of the Camden Coalition for 4 years, and I give a talk about our operational journey. The talk has a subtitle, The Camden Coalition, A History of Very Productive Failures. Because we've learned a lot along the way in addressing the social determinants of health, that there's a lot of learning to do, and there are no easy answers. And the last thing I want to say is really around in building a culture of health as it relates to all of your organizations in hiring and the role that hiring plays. So the words dignity and health have actually been dignity and respect have been used by a number of people today. And I'll actually say we use those words in changing our hiring criteria. To build a culture of health, we need a different kind of workforce. And we've learned, we actually removed all licensure requirements and all degree requirements from every job description that we could where we were legally allowed. The reason why is this. We discovered the #1 criterion as to whether or not you could be successful at the Camden Coalition was your ability to treat another human being with dignity and respect. That's what it means to actually build a culture of health. So when you go back, I want to encourage you, look at your job descriptions and look at your interview process and ask, are you screening for a person's ability to treat someone with dignity and respect? Because there's no degree and there's no license that can actually teach you how to do that. That's about being a human being. So thank you. We're honored to accept this award.